Welcome to this explainer on the 2026 AHIMA and ACDIS guidelines for achieving a compliant query practice. We're jumping right into the thick of it today, looking at the strict structural requirements for constructing clinical queries. Look, whether you're a CDI specialist, a medical coder, or a compliance director, getting this formatting right isn't just a nice-to-have. It's absolutely essential to make sure your queries are both compliant and effective.
Here's our agenda for today, which is essentially your syllabus for mastering the 2026 query standards. We'll hit the compliant framework, multiple choice standards, strict rules for yes/no, open-ended applications, and finally, the unable to determine distinction. Let's get right into it.
Section 1. The Compliant Query Framework.
Okay, right off the bat, let's talk about the foundation that governs literally every single query you write, no matter the format. At its core, every compliant query has to objectively present clinical indicators sourced directly from the health record. It must be non-leading, you can't steer the provider toward the answer you want, and crucially, you cannot mention reimbursement, quality measures, or denial mitigation. The whole point here is to let the provider use their own independent clinical judgment based entirely on the facts.
Moving on to Section 2, Multiple Choice Query Standards.
So, how do we actually construct the perfect multiple-choice query under these new rules? Well, this is widely considered the most robust and preferred format for clinical validation, but building one requires you to stay within some very strict guardrails to avoid inadvertently leading the provider. It's honestly fascinating how specific the 2026 standards get, especially regarding visual bias. You absolutely cannot use arrows, bolding, highlighting, or underlining to emphasize a preferred answer. It's like putting a neon sign over the answer you want, and it is totally prohibited. Also, every single option you provide has to be supported by sourced clinical indicators, meaning you must exclude irrelevant options. For example, if your patient has a low sodium level of 122, it would be a clear violation to include hypernatremia as an answer choice. And hey, there's no magic number for how many choices to include. Just provide as many as the specific clinical scenario warrants.
Plus, the 2026 guidelines explicitly mandate that you must always provide the treating clinician with a free text escape hatch. You'll usually see this formatted as Other, Please Specify, or Other Explanation of Clinical Findings. You've got to include this so you're never forcing a provider into a box that doesn't actually match their clinical judgment.
All right, Section 3, Strict Rules for Yes/No.
Now, yes/no queries are the most restricted format we have because they inherently limit a provider's choices. In fact, you're only allowed to use them in three very specific scenarios. First, confirming present on admission, or POA status. Second, substantiating a medical diagnosis that's already sitting right there in the documentation, like having an attending confirm a malignancy from a pathology report. And third, establishing or negating a direct cause and effect link, like a complication of care or an adverse reaction to a drug.
Now listen up, because this is absolutely crucial. Here is the non-negotiable rule. You can never ever use a yes/no format to introduce a brand new diagnosis to the provider. No way. The condition has to already be documented in some capacity, or you need to pivot to a multiple choice or open-ended format instead.
Next up, Section 4, Open-ended Query Applications.
Open-ended queries are generally the least preferred format, but sometimes they are exactly what you need. They're fantastic for capturing super complex clinical scenarios neutrally, or for documenting verbal conversations you've had with providers. But they have a pretty big drawback. Because you aren't giving them standardized options, you're basically leaving it entirely up to the provider's free response. And let's be real, sometimes that means you get a free text answer that is just as ambiguous as the original documentation.
Finally, Section 5. The Unable to Determine Distinction.
We need to really zoom in on this nuance. The specific phrase, unable to determine, represents true clinical uncertainty. It literally means the provider is saying, hey, I just don't have enough data or evidence right now to give you an accurate answer. It's an absolutely vital option to include so that providers aren't forced to just guess.
You've got to nail this coding distinction. Unable to determine means there's insufficient evidence to make a call. That is a completely different ballgame from terms like possible, probable, or unable to rule out. Those terms actually define an uncertain diagnosis that, according to official guidelines, might actually be reportable in the inpatient setting. They are definitely not synonymous. And remember, unable to determine is a mandatory option you have to include for both POA and yes/no queries.
So let's pull all of this together.
To summarize the 2026 rulebook, multiple choice always requires that other option for alternative explanations. Yes, no, and POA queries absolutely require the unable to determine option to stay compliant. And open-ended queries, while super flexible, leave you relying entirely on whatever the provider decides to write down.
So I have to ask, as you look at your own workplace, are your electronic health record templates actually align with these 2026 standards? Does your formatting inadvertently lead your providers? Do you have bolded text hiding in your multiple choice options? Are people using yes/no queries to drop brand new diagnoses into the chart? It is so important to audit your templates right now. Ultimately, applying these specific formatting guardrails is what ensures the clinical documentation accurately represents the patient's true clinical status, while leaving the final medical decision exactly where it belongs, with the provider. So take a hard look at your current query templates today. Would they survive a 2026 compliance audit, or is it time for an overhaul? Please like, share, subscribe to Decode Healthcare with Harshal.